thank you for clicking on this short video that will highlight some recent goings-on with CMS and AHRQ. You may still use the questions box on the right side of your computer screen, even though you're watching this from a recording. If you have any questions or would like more detail about the information presented here, please submit your question via the questions box on the page, and a member of the PRC CAHPS team will be happy to respond. For those who don't know me, I am Jan Gnida, PRC's Director of Patient Experience and Government Surveys. I've had a busy month of CAHPS activities and learning, and I have a few highlights to share for an audience who is interested in the inner workings of CMS, the primary sponsor for most CAHPS and reporting initiatives, and the Agency for Healthcare Research and Quality. AHRQ, or AHRQ as it is commonly known, is responsible for the development and/or evaluation of any survey instruments receiving the CAHPS brand. We'll talk first about the Patient Experience of Care survey being developed for the ED setting. This instrument is a rare tool not being developed directly by AHRQ, so it will not receive its official ED CAHPS name until CMS and RAND finish the development work and present it to AHRQ for the official CAHPS seal of approval. For the time being, it is EdPEC, and it has had a long gestation period, going back 3 years now. Representatives from CMS presented at the Emergency Department Patient Experience Conference hosted by the University Health System Consortium in late September, and the main takeaway was there is still more development work to be done. One of CMS's biggest challenges in figuring out how to measure ED experiences is the fact that so many ED patients eventually become HCAHPS eligible inpatients. CMS is now working with 2 versions of the survey. One version is to be used for patients who are treated and released in the ED, and the other version is actually a supplement to the HCAHPS survey to be used for patients who are subsequently admitted. More about those survey versions in a minute. I also want to draw your attention to this statement from CMS, noting that they do not intend for hospitals to replace their existing means of assessing ED patient experience. While many hospitals probably have the ED volume to support 2 surveys, I'm not sure how many have the money to conduct 2 surveys ongoing, or how many have the appetite to look at one set of results from CMS and then look at and respond to a second set of results from their existing survey. More than once during the presentation, the CMS representatives stated that the EdPEC survey is not being designed for process improvement uses, but we all know that is exactly what hospitals will want to do with it. My hunch is that CMS is feeling some new pressures from hospitals and ED physicians that they just can't figure out how to address. When the survey becomes official and required, it will be interesting to see what kind of caveats CMS will issue, explaining how the survey can and cannot be used. The next development phase for EdPEC is a mode experiment to take place throughout the first quarter of 2016. Perhaps some of you have already been contacted as a hospital randomly selected to participate. CMS is evaluating its 4 approved HCAHPS modes for this program. As with all mode experiments that occur in the CAHPS survey development process, CMS needs to administer surveys in all 4 approved methodologies to patients from each participating hospital in order to analyze the data and determine the impact of the data collection methodology itself. In addition, CMS has 2 other objectives for this mode experiment. They will be testing options for what to include in the HCAHPS supplemental questions, and they will be evaluating the possibility of allowing family members or others familiar with the patient's care to complete the survey as a proxy respondent. Now, this is where we are really going to get into the weeds, so if you love the nitty-gritty of CMS's development work, this section is for you. Okay. So CMS will be using 3 different survey versions in this test, although technically it's 4. Part of the analysis will examine the impact of supplemental questions on the responses to the core HCAHPS questions, so there will also be a segment of inpatients who were not admitted through the ED to serve as a control. For the ED patients who were treated and released, they will receive the Discharge to Community survey, which is 34 questions about their experience and 9 demographic questions. For patients who were admitted, CMS is testing 2 different lengths of supplemental questions to address the ED part of the hospital stay. Both of these supplemental question sets are shorter than the full EdPEC core because no one wants an 80-question HCAHPS survey. Both add-ons are abbreviated in the questions regarding communication about medicines and doctor and nurse communication. Part of this test is to identify which ED questions can serve as strong predictors for the reporting composites that will not be fully covered in the HCAHPS supplement. It is complicated. You can see why this is taking so long. If you'd like to see these survey versions, drop us a note in the questions box and we'll get them off to you so you can review the differences for yourself. Here is what the mode experiment looks like for admitted patients. Each of these green boxes represents 4 samples of patients that CMS will need for conducting all of the analysis they have described. That's 24 samples of inpatients, and 20 of those samples will be from the pool of inpatients who came through the ED. Not only do they have the 2 supplement versions to test, but then we also see the layer for evaluating the impact of proxy respondents. Again, this experiment will be conducted with January to March 2016 discharges. CMS is running a second test during that same time period with a separate set of 8 randomly selected hospitals. This feasibility test is intended to explore 4 novel approaches to data collection, and they'll be using the mixed mail-phone methodology as the control for this test. Using only patients who are discharged from the ED, CMS will be looking at 3 iterations of an online survey. One that begins with patients receiving the survey invitation through the mail, one that begins with patients receiving the survey invitation through email, and then another one with an email invitation, followed by a full survey in the mail, and that followed by a phone call if the patient has not responded via the first 2 modes. The 4th test will be a handout survey given to the patient at discharge with an envelope for returning the survey by mail. And then the handout form will also have call-in instructions if the patient would like to complete the survey by phone. Patients will not have the option to fill out the paper survey and leave it at the hospital as they go home. We applaud CMS's efforts to explore alternative methodologies. I think they're finding that response rates are particularly challenging with the ED patient population. It's possible, and I might even say likely, that none of these methodologies will pass muster and be approved for ED CAHPS, but it will be valuable to establish a baseline now so that they can come back in a couple years, try it again, and see if response rates are improving. CMS has a lot on their plate for the next year, so let's work through what this timeline might be. The data collection for both of these tests will be complete in June or so, and then CMS will have a whole mountain of data to analyze. I expect that will take at least 6 months. After the analysis, they will need to make final decisions about the content of the 2 survey versions, and they'll need to document the protocols and guidelines. Then that will all be submitted to AHRQ for the final CAHPS blessing. Given all of the work still to be done, I would be shocked if an ED CAHPS program is ready for national implementation earlier than July 2017. I definitely don't think it will be ready for January 2017. Now, since this is being recorded, we'll check back this time next year and see how good my predictions were. To follow the development process, you can check this website. We have a live link to the site here on your viewing screen. Or if you have specific questions, please use this email address to contact the CMS team that is overseeing this work. Now let's turn our attention to another event that took place in early October, the 2015 AHRQ Research Conference. Several years ago, AHRQ had been hosting a CAHPS user group meeting every 18 months or so, but the last one was maybe 7 years ago. The new CAHPS director at AHRQ made mention of this a few times during the recent conference, expressing appreciation that they were resuming the opportunity for all kinds of organizations, hospitals and health systems, clinical researchers, academics, survey vendors, students, all to come together and talk about their work to improve the quality of healthcare in the U.S. The agenda included 4 sessions that were specific to CAHPS measurement, and I've chosen 2 of those to share with you. The first was a reflection on 20 years of CAHPS and an exploration of what the future may bring. While HCAHPS is coming up on its 10-year anniversary next year, the whole thing began in 1995 with a survey that was used to measure beneficiary perceptions of their Medicare Advantage plans. That first year, with one instrument, CMS collected 10 million surveys. And 20 years later, with many instruments, CMS is projecting that they'll have about 146 million completed CAHPS surveys. That's remarkable growth, and the panel expressed their own amazement that CAHPS has grown far beyond its humble beginnings. The panel shared that the newest CAHPS surveys in development will be for long-term care, in-facility rehab care, and cancer care. No timelines or specific statuses were given for any of these. From our own work with the group piloting the Cancer CAHPS survey, we know that a cancer care survey should be presented to AHRQ within the next 6 months to receive the official CAHPS seal of approval. The new CAHPS director at AHRQ also talked about a few issues they currently have on their radar. She said supplemental items for the HCAHPS survey should be made available by the end of this year. These will address patient health literacy and the effectiveness of interpreter services. AHRQ is also continuing to think about patient survey fatigue. They recognize that as more and more CAHPS surveys are developed and adopted by CMS, the potential for overlap for a single patient grows. What can be done to ensure that we're not burning out our patients by asking too many questions with too many surveys? And finally, the director spoke about online survey administration. AHRQ understands that there is great interest among healthcare organizations to allow for online surveys for CAHPS, but the data aren't showing yet that this methodology can yield a representative sample of patients. Factors working against this methodology at the moment are limited sample frames due to the fact that hospitals still have a lot of gaps in their email contact information for patients. Also, noticeable demographic differences between people who do and do not use the internet, and then occurrences of online security breach. Everyone seems to agree that we are headed in the direction of online data collection, but these shortcomings are still too prevalent for AHRQ to overlook. The other presentation I'm highlighting today dealt with patient narratives, how they can be gathered and then presented to consumers in a useful way. AHRQ acknowledges that despite their best intentions for putting hard numbers in front of consumers with sites like Hospital Compare, people seem to respond better to stories than numbers. Websites like Yelp, RateMDs, Vitals.com, and others get a lot of traffic because healthcare consumers want to hear about the first-hand experiences of other patients. So AHRQ is working to develop some scientific standards for what that could look like. The narratives that they're talking about go beyond adding 1 or 2 open-ended questions at the end of a survey. The development team has created 7 open-ended questions that serve to meet these goals and really build a storyline of the patient's experience with their doctor. They've been testing both telephone and online survey approaches that are taking about 5 to 10 minutes for patients to complete. AHRQ has also been investigating website design to understand how consumers would like to review this information and how they can present these narratives alongside the numbers to help consumers make smart choices about where they receive care. They'll be starting a second round of web design testing with their Artificial SelectMD website next year. It's really quite interesting work, and it represents a true effort to provide healthcare consumers with the kinds of information they want. I did note a twinge of frustration that people aren't gobbling up all of the quality numbers and metrics that CMS would like them to use for making decisions, but it sounds like they're working toward a compromise approach that will satisfy everyone's interests. The link on the slide here is for a 2014 AHRQ webinar on this topic, if you're interested in learning more about their work in this space. The link here is live. You can click right on it. Thank you for watching this CAHPS Updates video. Again, you may use the questions box to the right in your browser window to submit a question about anything you've seen today, or my contact information is included here as well. I look forward to bringing you more CAHPS news in the future.